The process of receiving malaria and hepatitis B vaccines comes at a time when there is no ready Ebola Sudan strain vaccine, calling for more research to get more vaccines. The Chief Executive Officer, Gavi, Dr. Seth Franklin Buckley, says scientists must come together and forge ways of getting the Ebola Sudan vaccine before it escalates.
We will say for the global community, it's a disgrace that we don't have a vaccine fully ready for Ebola Sudan, because when we had the Ebola outbreak in West Africa, we worked to make sure that there would be an Ebola Zaire vaccine, and we now have a stockpile that's licensed. We have 500,000 doses always available, and we use doses when they get close to their shelf life. If we don't need them for outbreaks, we then vaccinate health workers. There are actually 6 different vaccines, but 3 are at the top of the queue in terms of having had testing in animal models, having some testing in humans, having pretty good sense that these will work, but of course you don't know until they're tested. And so we hope that all 3 will be fast-tracked to testing, but obviously, our hope would be that the epidemic ends first. That's always our hope, but we want to get these tested if we can, so that we're ready for this outbreak if it gets worse, or for future ones. But just to be clear, it's not a silver bullet. We're not waiting for this, because we still need contact tracing.
He cautioned the public to respect the standard operating procedures set in the fight against Ebola.
So Uganda has had in the past really, really good control. And so you need to do that now. Of course, the secret on that is contact tracing, and not having people go underground, travel, and we've seen.
The Health Minister, Dr. Jane Ruth Acheng, thanked Gavi for funding the manufacture of malaria and hepatitis B vaccines.
One of them is the malaria vaccine. And again, the NITAD group are here. At least I see Dr. Sabrina. We are preparing for that. And the hepatitis B birth dose, all supported by Gavi and championed by Dr. Seth Beckley, who keeps on insisting Uganda should be one of the first countries to receive the malaria vaccine. We are aware of that, and we are losing a good number of children every day, including to the black water fever. So the sooner we get the malaria vaccine, the better.
Minister said there is need for accountability of funds sent to districts for health strengthening, because it is one of the challenges faced by Gavi.
We are the challenge to Gavi. And Gavi is yet to find a solution with us. One of the challenges is that we don't account for resources. And we've been moving back and forth on this issue. And yet the more we account, the more money we get. When we don't account, we even have to refund.
Makerere University recognized Dr. Seth Franklin Buckley and was honored with the Makerere University prestigious Honorary Directorate of Science. Gavi is working with Ministry of Health to ensure that preventable diseases have vaccines and ensure that all children are vaccinated. Sudat Kaye.